Venetoclax, the BCL2 inhibitor, I think, targeting the 11-14 population, which accounts for about 20-30% of all patients with myeloma. And responses are phenomenal for this population of patients. As a single agent, was very active. In combination with dexamethasone, the responses were about 60%. And then we see, with the carfilzomib up to 100%, so it's amazing. We had some, concerns about the increased risk of infections. All patients are now receiving antibiotics, prophylaxis, and so we'll see what's happening. But again, I had the fortune of working with the drug for many years and with very good results. Recently, the Bellini study is a phase 3 randomized study where patients in the relapse setting were randomized to receive bortezomib, dexamethasone, which is a little bit of the backbone, a standard of care, versus bortezomib, Venetoclax, and dexamethasone. And the primary endpoint of the study was progression-free survival, which was met. It was superior statistical significance. It's actually quite amazing. But unfortunately, the overall survival was inferior because unfortunately there were an increased number of deaths in the Venetoclax, bortezomib, dexamethasone combination due primarily to infections, bacterial infections. And so that raised a lot of questions. How immunocompromised are these patients? Do we need to use antibiotics consistently? In the past, we used to do that with a pulse dose dexamethasone, and then we stopped. But now probably is the way to come back. We do have studies showing the antibiotic prophylaxis is important. And so I think we're all waiting for additional analyses.